Hello, this is Dr. Lewerenz from Longevity Health Institute. I know you guys all out there follow me, and I appreciate that. I'm here in Nashville, Tennessee, at a conference that's been put on by Designs for Health, and I have a wonderful guest here that I met, listened to his lecture today. Amazing book he's got here, great research and science on vitamin E and tocotrienols. And the thing that was wonderful is his personality.
Thank you.
His personality, that was everything, okay? And forgive me, by the way, because in Nashville here, it is super hot. So I walk here and I'm sweating, so I got my hat on from Smashville. But I thought I could talk to you about this. You guys know out there, you hear me talk about on my videos and my presentations, all about fatty liver. And it's truly an epidemic, isn't it?
Yes, it is an epidemic. About 80 million Americans have a fatty liver, and it's a silent disease, and unless you get blood work, you will not be able to feel any pain or anything like that to find out yourself.
Exactly, yeah. And Dr. Tan here in his book explains some things about fatty liver and about tocotrienols. He's a PhD and way smarter than me, but I take his type of science and bring it to you to fix you and help fatty liver. For instance, many of you know out there in my other videos, in my podcasts, etc., that when you do work on carbohydrate reduction, lose weight, studies show exercise, and taking the appropriate vitamin E that Dr. Dan here is going to tell us about, okay, you can actually reverse fatty liver. And real fatty liver, where not just a lab result gets better that you have done by myself or even your practitioner, but also an ultrasound will see the liver shrink and get rid of the fat. Can you talk about that a bit?
Yes, we did the study a year ago, and it's published, and it's a special kind of vitamin E, not your normal generic vitamin E. And this special vitamin E, I happen to have a molecule here. This is an antioxidant because double bond OH group here. A normal vitamin E would not have these three double bonds here. But this is a special vitamin E called tocotrienol, and I've besides my personal book, that's the title here of the book, scientific book, tocotrienol, and it's extracted from the lovely plant that you see behind you. It's called annatto. Annatto is where we extract the color for coloring cheeses and anything else. We remove the color, and voila, this compound is found there. So it's an all-natural compound. We gave it to people who are certain to have NAFLD, and in people with NAFLD, the liver enzymes are high, and then the triglyceride is also high. So we consistently saw the triglyceride drop. It's very difficult to lower people's enzyme, and the enzymes drop. We did it at 6 months and completely a different study. At 3 months and completely a different study at 6 months. And both at 3 months and 6 months, the enzyme continued to drop, the triglyceride drop. The C-reactive protein dropped as well.
So, which is inflammation.
Which is the
root of all disease.
Yeah. So for this is a remarkable thing. And the dosage is about 300 milligrams a day.
Excellent, excellent. And what does this mean to you? Well, as a clinician, as a practitioner, I see you every day where we're working on weight, which is one of your goals, getting healthier, reducing cholesterol, okay? And you've been told often that high elevated liver enzymes in internal medicine and your primary care is okay and acceptable. And I'm here to tell you it's not the first time I've told you that, but here's the thing is, this wonderful product, this wonderful plant, and all the science behind Dr. Tan, they showed that we can actually reverse this. And not only reverse it where you are healthier, but this actually helps the progression of weight and obesity and dyslipidemia, and as I said earlier, inflammation. So this scary thing here, which is really real, okay? It's doing wonderful things.
And let me just add one more, because you said we are trying to control our weight. When we did this study on these NAFLD people, we were not looking for weight loss. So at 3 months, they lost about 10 pounds, and then at 6 months, they lost about 17 pounds. So it's not a concocted thing, and it's not a weight loss product. However, it did lose weight on people at 3 months and 6 months, concomitantly at 10 pounds and 17 pounds. What is there not to like with this unusual vitamin?
And you hear me say this. I say this to my patients all the time in practice, is that they come in with goals, and then I have goals.
Yes.
And the goal is to make them healthier and solve their goals. And everybody that comes to me, not you, everybody wants to lose weight. That's always on their list.
Yes.
So if that's a side effect of getting healthier and doing the right
Yes.
thing for your liver, amen. And if you can reduce inflammation, like this tocotrienol, this type of vitamin E does, okay, you will be well. And what do I always say? You don't want to just survive, you want to thrive. So
Be blessed and be well.
Yeah, absolutely. Well, it's been a pleasure.
Thank you.
Okay, this guy's a wonderful genius. I'm sure he's got many other things in the pipeline to keep us living healthier, longer, better. And it's been a pleasure, and thanks for your lecture yesterday.
Thank you, doctor. Thank you.